The initial gown is opened separately on the mayo stand or other small table to prevent contamination of the back table when entering the sterile field. The procedure is as follows. Check integrity of wrapper. Orient the gown package on mayo stand. Grasp tab and open the first fold away from you. Grasp tab and open the second fold in the appropriate direction. Grasp tab and open the third fold in the appropriate direction. Grasp the tab and open the fourth fold towards you. The basin set may be opened onto the single or double ring stand according to the type of basin set and planned procedure. The procedure is as follows. Check integrity of the outer wrapper. Remove the dust cover. Check integrity of inner package. Orient basin set on appropriate size ring stand. Break or remove the seal. Unfold the first flap in the appropriate direction. Unfold the second flap in the appropriate direction. Position yourself or the ring stand to open the third flap. Insert your hands under the cuff. Extend the drape to cover the ring stand. Excess material is allowed to drop toward the floor. Move to the opposite side or rotate the ring stand. Open the final flap. Place the ring stand in close proximity to the back table. Small sterile items are frequently packaged in peel packs. Items within a peel pack may be opened directly onto the sterile field, often into the basin set. The procedure is as follows. Check the integrity of the peel pack. Orient the package in both of your hands by grasping one edge of the peel pack in each hand. Slowly pull the sides of the peel pack away from each other. Balance the item contained in the package so it does not slide towards the edges and become contaminated. Continue to open package while assuring that a safe distance is maintained from the sterile field. Transfer the item onto the sterile field by tossing gently. Do not cross the boundary of the sterile field. Retract your hands as soon as the item is airborne. Discard the wrapper. Sterile items that are too large or heavy for a peel pack will be contained within a paper or cloth wrapper. Items within a wrapped package may be opened directly onto the sterile field, often onto the back table. The procedure is as follows. Check the integrity of the package. Orient the package in one hand so the first fold will be opened away from you. Break or remove the seal. Open the first fold away from you with the opposite hand. Secure the flap in the hand holding the sterile package. Open the second fold and secure the flap. Be certain that you do not reach over the exposed sterile item. Open the third fold and secure the flap. Open the fourth fold and secure the flap. Transfer the item onto the sterile field by tossing gently. Do not cross the boundary of the sterile field. Retract your hand as soon as the item is airborne. Discard the wrapper. A variety of container systems are available. Product differences and school or facility policy may necessitate the adaptation of this procedure. Place instrument container on a suitable surface, such as a ring stand. Check integrity of the instrument container. Be sure all filters are present. Verify change in color of external chemical indicator. Verify expiration date if applicable. Break or remove the seals, assuring that fragments of the seal do not become airborne. Manually release the mechanism securing the lid. Lift lid vertically until 8 to 12 inches above the container and step back. Invert the lid and inspect interior. Verify that the contents are dry and that the filter is intact. If visible, verify if the internal chemical indicator has changed color. Place the lid in a convenient location. Note, once scrubbed, the STSR will retrieve the instruments from the container with the assistance of the circulator. The next subsection of skills that you will see relates to the second principle of asepsis. Sterile team members must be appropriately attired prior to entering the sterile field. Each of the following skills pertains to entering the sterile field. For your convenience, gown and glove removal will also be covered in this section. The open glove technique is employed in situations in which a sterile procedure of short duration will be performed. Examples include Foley catheter insertion and the skin prep. Gloving to perform a skin prep will be demonstrated. Open gloving is not recommended when wearing a sterile gown. The procedure is as follows. Remove the glove package from the prep set without contamination of other items contained within the prep set. You may touch the glove wrapper with clean hands and place it on a clean surface. Open the wrapper to create a small sterile field. You may touch only the outer edges of the inside of the wrapper. A 1 to 2 inch perimeter is allowed. Secure the first glove from the wrapper by pinching the cuffed edge. Lift the glove up and away from the wrapper. Keep the glove away from yourself and other objects. It is helpful to keep the fingertips pointing downward to prevent contamination. Apply the glove by inserting the fingers of the hand to be gloved and pulling the glove over your palm. The cuff of your glove may be unfolded at this time. Secure the second glove from the wrapper by inserting the fingertips of your already gloved or sterile hand under the cuffed edge of the glove. The thumb of your gloved hand may be tucked under the cuff of the glove, or it must be kept well out of the way to reduce the risk of contamination. Lift the second glove up and away from the wrapper. Apply the glove in the manner previously described. Make any minor adjustments. It is recommended that the glove wrapper be discarded at the end of the task. This technique is used to remove gloves that have become soiled or contaminated to reduce the risk of exposure to pathogens. The procedure is as follows. Grasp the palm of the glove to be removed first with your opposite hand. Invert the glove as you remove it. Be sure that you do not touch your skin with your gloved hand. Use slow movements to prevent snapping of the glove and splattering of debris. Begin to remove the second glove. Slide your bare hand between the skin of your wrist and the second glove. Touch only your skin and the inside of the second glove. Invert the glove as you remove it to contain both gloves. Dispose of the gloves. Wash your hands.
The surgical scrub is performed prior to donning the sterile gown and gloves in preparation for entry to the sterile field. The purpose of the surgical scrub is to remove the transient microorganisms and to reduce the number of resident organisms on your skin. There are several effective methods for performing the surgical scrub. The counted brush stroke method will be demonstrated. The procedure is as follows. Wear all necessary personal protective attire required by the procedure. Inspect the integrity of your hands and arms. Open the brush package. Turn on the water and adjust to a comfortable temperature. This is especially important if the scrub sink has a hand-controlled mechanism. Wet your hands and arms, apply the soap, lather to 2 inches above your elbows. Obtain the nail cleaner and clean each subungual space and around the cuticle if necessary under running water. Note: once you begin the surgical scrub, your fingers, hands, and arms may not come in contact with anything. Rinse. Keep your elbows bent to allow water to run off your elbows. Secure the brush from the wrapper and add the soap and water as required for adequate lather. Begin scrubbing your fingers on your first hand. Place all fingertips together on your first hand. Simultaneously scrub all nails and cuticles. Count 30 strokes. One stroke is the combined movement in both directions. Each finger is divided into 4 planes. Use 10 strokes per plane. Each web space counts as a separate plane. Progress in an organized fashion to be sure that all surfaces receive adequate chemical exposure and mechanical action. Scrub your hand by dividing it into 4 planes. Use circular motions. 10 strokes per plane. Divide your arm into 3 sections for the remainder of the scrub. Each of the 3 sections is further divided into 4 planes, and each plane is scrubbed with 10 brush strokes. The scrub continues to 2 inches above your elbow. Transfer the brush to your scrubbed hand and repeat the process on your opposite side. Conserve water if possible. If a contamination occurs at any point in the scrub process, you must repeat the entire process from the beginning. Discard the brush. Rinse from your fingertips to your elbows. Keep your elbow bent so that water runs off your elbow. Do not allow water to splatter. Be aware of your space constrictions. Use caution not to touch the sink, faucet, scrub attire, or others standing nearby. Turn off the water. Allow excess water to drop into the sink. Proceed to the OR. Use your hip to open the OR door. This technique for drying and donning the sterile gown and gloves is always used by the first person to enter the sterile field. Others entering the field later may also use this method if the STSR is unable to assist them. The procedure is as follows. Enter the OR. Approach the sterile field. Lift the towel from the sterile field without dripping on or touching the gown, gloves, or wrapper. Step away from the sterile field. Unfold the towel. Do not allow the edges to fall below your waist. Hold the edge of the towel in the palm of one hand. Dry the opposite hand and arm using a patting motion. Bend slightly at your waist to avoid contamination of the towel on your scrub attire. Transfer the towel to the opposite hand. Do not cross your hands or pass the towel over your scrubbed hands. Discard the towel. Approach the sterile field and secure the gown by grasping it at the center near the neck. Do not touch the gloves or the wrapper. Lift the gown from the wrapper and step back. The gown remains folded. Hold the inside of the gown near the shoulders and allow to unfold. Begin to don the gown by slipping your hands and arms into the sleeves. Slide the gown over your arms using a swimming motion. Your hands must remain within the cuff of the gown. Flex your elbows to hold the gown in place. The circulator will assist with the final gown adjustments and fasten the neck and back of the gown. Approach the sterile field with an awareness of environmental hazards. Secure the first glove. The glove is aligned on the palm of the hand that you will glove first. The thumb side of the glove is toward your palm and the fingertips are toward your elbow. Pull the cuff of the glove over the cuff of the gown. Unfold the cuff of the glove to completely cover the cuff of the gown. Grasp the glove and the gown at your wrist level. Work your fingers into the glove as you pull the glove into position. Secure the second glove and apply using the same technique. Double gloving is recommended. The second pair of gloves may be applied using any technique that is convenient. Prepare to wrap around the back of the gown. Be sure the circulator is available to assist you. Secure the tag in your right hand and the gown tie in your left and separate. Pass the tag to the circulator at your right side. Be sure to hold the gown tag to allow the circulator maximum space to grasp the tag. Do not turn your back on the sterile field. The circulator will move behind you, wrapping around the back of the gown. Transfer the gown tie from your left hand to your right. Accept the gown tie from the circulator at your left. Secure both gown ties. The gown and gloves are considered sterile in the front from the waist or table level to the mid-chest line. This is referred to as the sterile zone. This technique for drying and donning the sterile gown and gloves is used for additional team members entering the sterile field and requires the assistance of the STSR. The procedure is as follows. Lift the towel from the sterile field. Step back. Do not turn your back on the sterile field. Unfold the towel. Do not allow the ends to fall below waist level. Protect your hands by rolling the towel over your gloved fingers. Present the towel to your team member by holding it taut and placing the edge of the towel on your team member's extended palm. Do not make contact. Lift the gown from the sterile field. Gown remains folded. Step back without turning your back to the sterile field. Unfold the gown so the outside of the gown is toward you. Place your hands near the shoulder area of the gown. Allow the neck and shoulder area of the gown to fold back over your hands, protecting them from contact with the individual that you are assisting. Present the gown to your team member by extending your arms. Remain still while the team member places their arms into the gown sleeves. Drop the gown onto the team member's upper arms. The circulator will assist with the final gown adjustments and fasten the neck and back of the gown. Expose your team member's hands if necessary. Secure the right glove from the wrapper. The right glove is always applied first. Step back from the field and prepare the glove by unfolding and orienting with the thumb of the glove facing your team member. Roll the glove cuff over your fingertips, creating an opening in the shape of a circle. Extend the glove toward your team member. Hold securely while the team member inserts his or her right hand. Ensure that the cuff of the glove completely covers the cuff of the gown. Repeat the procedure for the left glove. It is recommended that the circulator assist with wrapping the back of the gown. Two methods of gown and glove removal will be presented.